sharing today is the project that I work with my colleagues, the big team of architects, landscape architect, urban planner. We've been working on project on city for quite some time, but a couple of years ago, I think we kind of get together and talk about the important element of city development. It's actually about health of the citizen. Uh, no matter how good the city, you design or you develop, but if the people in the city is unhealthy, why do you need a beautiful city for, right? Um, for this project, it's part of the Healthy City and Community Development Network project. And the purpose of this project first is to forecast the trend and come up with strategies for healthy city development in Thailand. And also we work in many levels. First we work uh, on the policy framework, and also we have another team work with city officials, introducing them to the concept of healthy city. And also we work with design school to engage new generation and work on green space project all over the cities. We receive research grant from Thai Health Promotion Foundation, and the project is finished um, uh, last year, and this year we got another funding as well to continue the work. First, we kind of try to understand the definition of healthy city, and according to WHO, healthy city is one that continually creates and improves its physical and social environment and expand the community resources that enable people to mutually support each other in performing all the functions of life and developing to their maximum potential. You can see that the focus of the definition is actually not on city. It's about people, how people kind of work together, to create a better, healthy environment. For Thailand, uh, we learned about the concept of healthy city about 10 years ago by Professor Panit Pujinda from Chulalongkorn University. He's also an urban planner. Um, but the definition that he gave, 10 years ago, he actually focused on the physical city itself at the beginning. And also another definition came in later in 2018. Still, he focused on the physicality of the urban space. The people, the citizen element is kind of missing. Um, uh, what we have been doing, we think the way that we want to approach this project, we have to introduce this concept to the government. And the best way to talk to Thai government is to tell them that this is nothing new. It's been done before, the whole world, and we should learn from that. We look at the concept of healthy city, and we discover that there are healthy city network established by WHO long time ago. And the purpose of Healthy Cities Network is to foster the creation and development of both physical and social environment, and also enhancing resources that enable community members to support each other. And we think this is a very clear purpose that we can maybe introduce this to the government, and hopefully they could somehow put it into the policy in the future. Also, the Healthy City Network is expanding all over the world. WHO also provides support in policy development, urban development strategies, technical assistance, and also capacity building. Actually, in Southeast Asia, we have a very active network. And Thailand, we have many cities involved with Healthy Cities Network, and Bangkok is one of them. But as we talk to city officials, somehow the research or the project on Healthy City Network is implemented by the university, and the city official still find this concept very new to them, and they're not putting any aspect of healthy city in that policy yet. That's why we discover the missing link, between the research and also the policy and city officials. We look at the big picture. We look at the global trend. We can see that the trend of healthy city development also have some connection with the SDGs. For example, in many countries, they have national policy, health in all policies, which is all inclusive, in every policy of every government officials department. They all concentrate on the health of the people. Have health infrastructure, they have green space, they have 15-minute city concept, and third is all inclusive service, and planning. Fourth, they have circular model and local production. Fifth, they have very, very strong participatory process, which I think this is the key to success, because when people kind of, step up and shout out that their health is important, everyone have to listen. But if they're not aware of their rights to have good air, clean water, then they will still living, in the polluted environment. And the sixth, I think this is becoming very popular right now, is smart healthy cities. We can see that there are many technical solutions that coming to play and help, the city official and administrator to kind of execute, and clear any city problem related to health. For Thailand, we discovered that there are many stakeholders that they've been working on healthy city project for quite some time, but they're not they don't have opportunity to meet with each other or even collaborate. We use these projects as a platform, and we find all of them and get them together in one room, and then ask them to share with us what they have done in the past until now, to put together the project that already implemented, and some of the project that is in the process of finishing, and somehow to see that how stakeholders kind of move around the city and try to use the healthy city concept to tackle city problem. And what we discovered was there are many public sectors that are responsible for healthy city project. For example, Department of Public Works, Town and Country Planning. They have some policy related to that, but they haven't been promoted. Sorry. Private sectors, we discovered that there are some real estate company that also concerned about this issue and even have funding, research funding to do on their projects. For academic sector, there are many research projects related to healthy cities. And also for community sector, some of them already working on this issue and have some best practice that they can share with community. We got all of this together and make a mapping of what have been done, in the context of Bangkok and Thailand. Right now there are 6 directions of healthy city development in Thailand. First, many of them focus on human-centered approach. For example, aging society, active citizen, and child-friendly cities. The second thing that they focus is the participatory process to raise awareness of people in the city. They have a collaboration platform for reduce generation gap, and also some concept of participatory governance. We have public-private partnerships projects. We have project on healthy space, public space as an asset, and also 50-minute pocket parks project has been adopted by the current governor of Bangkok. We have healthy cities activities in the community, and also we have food security project in some area of cities. These are directions that Bangkok is taking on right now. For the next phase, we try to use some development framework to introduce to the government because it's somehow easy for them to formulate the policy that go directly with the concept of healthy city, and also work back to their responsibility of government officials. First, we will ask them to focus more on the people to come up with citizen-centric policy and dealing with human focus and societal development, and also prioritizing investment in the people to improve equity and inclusion through enhanced and empowerment of the people. Second, we introduce the concept of place because people need a good environment, physical environment, cultural environment to create a place that is actively inclusive and facilitate the pursuit of health and well-being for all. Introduce concept of green space, healthy space and setting, and also healthy transport. The third concept is the participation. We would like to make sure that every policy went through a co-creation process to have citizens at the center of the creation of the policy. And the participatory process will somehow raise awareness of the people and also engage government officials to work together in the long term. Oops. Oh, the last slide. Okay. Um, let me see the last slide somehow has problem. Okay, and both concept is about prosperity. We think healthy city have somehow to connect with the economy itself, and the fifth one is about peace and safety, and the sixth one is about the concept of the planet. Somehow to ensuring the protection of the planet. Somehow we will ensure that citizens will have a healthy life. Also, the concept of healthy environment, water and sanitation will be a crucial part of healthy cities. This year, we will continue working on this project, and our goal is to engage more on government officials, and we'd like to make sure that at the city level, we will have a strong policy on healthy city, and also the most important thing is to have them allocate some budget to work with this issue and raise awareness of this problem to the citizen. Thank you very much.